Hi, everybody. I'm back. So I'll introduce myself again. I'm Carrie Mahar, and I am the program head of the Emergency and Pediatric Emergency Nursing Program. I will be speaking for this portion just about the Emergency Nursing Program. Julie, if you could advance the slide, that would be great. So who is this program for? As you can see on the slide here, RNs looking for emergency certification or completing their specialty BSN in emergency. Also, this program is for undergraduate nursing students currently completing an accredited BSN program. In addition to these 2 points, I also like to share a recipe for success and some important ingredients or characteristics of an emerge nurse. So it's really important as an emerge nurse that you have strong, detailed assessment skills. So attention to detail is very important as an emerge nurse. Our patients don't walk through the doors with their diagnosis pasted to their forehead or on their chest. We have to become little detectives, and our assessment skills are very important. We have to learn to pick up on. We also have to have a curious mind. You need to learn and grow every single shift. Illnesses that come through our doors on a daily basis, you're always learning something new. So being curious and always wanting to learn and grow is really important as an emerge nurse. Another important ingredient or characteristic is really making order out of chaos. As I alluded to earlier, the emerged environment is very fast-paced. It's very dynamic and chaotic at times. So being able to slow down, take a step back, take a deep breath, and determine your priorities and who is your sickest patient is really, really important. Being proactive is also an important characteristic. So planning ahead and being able to anticipate your patient's needs are really essential. The moment you start falling behind and become more reactionary in your approach, you're starting to get into trouble. So we're always thinking ahead and critically thinking and using our brains to determine what our patient's needs are or what could potentially be their needs. Knowledge is also important. Strong pathophysiology foundation is really important. Our theory courses and clinical experiences are very patho-heavy. So having a really strong knowledge in patho knowledge is important to help build your knowledge through the theory courses and clinical experience. So if you're someone who really likes to work in a dynamic, fast-paced environment and have some of these characteristics, emergency nursing could be for you. Okay, Julie, thank you. Next slide. So our program here at BCIT has been around for more than 35 years. So over the years, we've really learned what nurses require to be successful and safe working in such a dynamic and fast-paced environment. So our approach is very learner-centered. We recognize all the nurses that are coming through our program have really a tremendous amount of knowledge and experience to draw from as they're learning. So our approach is very collaborative. We like to learn shoulder to shoulder with our students, and we really like to utilize different resources and tools to meet our students at where they're at in their learning. So our program is a blend of a comprehensive curriculum, so of both emergency nursing theory as well as clinical practice. And our core courses that students take through this program have the necessary pathophysiology, assessment framework, and nursing theory to allow the nurses to care for really a diverse range of patients coming through the doors and a wide spectrum of age as well. So I will speak just to one more thing just about the program delivery. So our program does consist of 6 courses, so 4 theory courses and 2 clinical experiences for a total of 24 credits. And we do run 2 different models that Kathy had spoken to already. So we deliver our program through distance learning, which is over 12 weeks and guided by the distance model with additional support from faculty in the Emerge program as well. This also helps you as you work full time and work through the course and being a student again. So it's a nice slower paced model for those that have quite a busy life. We also run the CTF model or the compressed time frame, which has been Kathy spoke to as well and the other program heads. This is offered in a full-time study format, and they allow you to take several courses at once over a shorter period of time versus 1 course at a time. You can skip to the next slide there for me, Julie. Thank you. This is my contact information. You're more than welcome to reach out to me anytime with any questions, as well as Maya, who is our program assistant.